The COVID death toll grew today in Douglas County, climbing to 634.
Now compare that to the flu epidemic 100 years ago when nearly 1,200 died in Omaha, twice as many, and the population was smaller. One of the highest death rates in the country.
New tonight, Brian Mastery takes us back to that 6-month stretch beginning in the fall of 1918 and the striking similarities we found compared to today's pandemic.
A year ago, 70 Americans from China came to Omaha to be quarantined for possible exposure to the coronavirus. Stranded cruise ship passengers soon followed. Within weeks, the virus, renamed COVID-19, flooded the country. 471,000 have died in the United States.
We are very quickly approaching that number that we hit in 1918.
The influenza epidemic killed 650,000 Americans 100 years ago. Alex Navarro, a historian at the University of Michigan, examined how a number of cities handled the illness then, including Omaha, and what we could learn.
The population, however, was a third the size it is today.
100 years ago, Omaha put mask orders in place, encouraged social distancing, and limited big gatherings. Sound familiar? You couldn't stand in the streetcar to limit congestion. Some businesses like theaters and movie houses and bowling alleys were ordered closed.
There were lots of examples of that pushback, and there were lots of people who just didn't comply with masking orders, for example, or who continued to have gatherings.
America was at war, so that dominated the front page of the Omaha Daily News 100 years ago. Readers were told a flu veil was worn by women of fashion. But his parents died of influenza at alarming rates, leaving churches to care for their children. Mixed messages came from the same Omaha health commissioner who had taken drastic steps to stop the spread early in the epidemic. He believed personal responsibility of Omahans, not closure orders, would make the difference. Businesses reopened after a month layoff. Parades resumed, ignoring social distancing guidelines.
Omaha actually had a second spike of cases in that fall wave that was just as bad as the initial spike. And the reason is that people just didn't take it seriously. And it's not just Omaha. When we see it in 1918, we see it again today. When you remove those rather strict public health measures that nobody wants to live under, so it's understandable, but when you remove those and you tell people, okay, now it's up to you to do the right thing and not gather on your own, for a lot of people, what you're really giving them is a mixed message. So you're telling them it's serious, but it's not that serious, because if it was serious, they would keep the orders in place.
Alex Navarro says Omaha fared worse during the influenza epidemic of 1918 than most other cities.
It seems that Omaha didn't have as maybe high levels of compliance as some other places.
But when it comes to learning from history, there's this. Researchers found most communities handled the first wave of COVID-19 and the isolation better than 100 years ago.
We did a better job in the spring of 2020 than we did in the fall of 1918. I'm glad I'm a historian and not a public health policymaker. It's really difficult to get a high level of compliance for a long time with something like a closure order, gathering bans, even mask orders. Humans are social creatures.
On your side in Omaha, Brian Mastery, 6 News.
During the height of the flu epidemic in Omaha, people were fined if they even left their home while under quarantine. In fact, the health department put a poster on their front door so neighbors knew they were ill.